What are the main tuberculosis risk factors? Understanding the risk factors for tuberculosis, or TB, is crucial for prevention and control. TB risk factors can be divided into two main categories: those that increase exposure to the bacteria and those that heighten the chance of developing active TB disease after infection. First, let's look at the risk factors that increase exposure to TB bacteria. Close contact with someone who has active TB, especially if it affects the lungs or throat, is a significant risk. Living or working in places where TB spreads easily, like homeless shelters, correctional facilities, or nursing homes, also raises exposure risk. Additionally, being born in or frequently traveling to countries with high TB rates, such as many in Asia, Africa, and Latin America, can increase your chances of exposure. Certain occupations, particularly healthcare workers caring for TB patients, are at higher risk due to their work environment. Next, we have risk factors that increase the likelihood of progressing from a TB infection to active disease. Individuals with weakened immune systems are particularly vulnerable. For example, those with human immunodeficiency virus, or HIV, have a significantly higher risk of latent TB infection turning into active disease. Other conditions, such as diabetes, cancer, or chronic renal failure, can also impair the immune response and increase risk. Recent TB infections, especially those within the last 2 years, pose a higher risk for developing active disease. Young children, particularly those under 5 years old, are at greater risk due to their developing immune systems. A history of untreated latent TB infection or active TB disease can also increase susceptibility. Low body weight, defined as less than 90% of ideal body weight, and substance use, including tobacco, alcohol, and injection drugs, can further compromise immune defenses. Pregnancy and certain viral infections, like viral hepatitis, may also contribute to increased risk. Social and environmental factors play a role too. A history of homelessness often leads to crowded living conditions and limited access to health care, which can facilitate TB transmission. Living in medically underserved or low-income areas, where TB incidence is higher, also increases risk. In summary, the risk of TB is influenced by both exposure to the bacteria and individual health factors that weaken the immune system. Addressing these risks through public health measures, timely diagnosis, and treatment is essential. If you have any of these risk factors, it is important to seek medical evaluation and follow health care advice for testing and potential treatment.